Do you know your skin type? We all have one, and knowing your skin type could help the doctor take better care of your skin. Well, today we're going to learn about 4 different types and how to treat them. Well, Dr. Ashley Chandler with the Skin Center of Charlotte Plastic Surgery is joining us now live, and so good to see you, Dr. Chandler. How are you doing?
Good. How are you doing?
I am doing great. I'm very interested in this topic, especially as the temperatures cool down a little bit outside. You say there are 4 different skin types. So how do you know which one you are?
So it's actually really hard to know your skin type. So we all think either I have oily skin, I have dry skin, I kind of in the normal, or I have a combination. And that may change with the cold weather and the heat going on. And we all have that drawer of products that we've spent hundreds of dollars on. And we bought this thing that worked great for our friend, or, this influencer we saw on Instagram. And we buy the product and it doesn't work for us, right? It irritates your skin. It didn't do what you thought it was going to do, or, you break out from it. So we throw it in the bottom drawer and it's just another bottle wasted.
Yeah.
So having a complex skin analysis is a really important thing to know exactly what you have, your system has, and how we can treat it. So how we do it at the Skin Center at Charlotte Plastic Surgery is we have a machine called the Visia. So the Visia can actually tell you what kind of skin you have. It can look at your pore size. It can look at the UV damage you've had over the years when we were young and not wearing sunblock. It can also look at your wrinkling, the amount of pigment you have, and even your moisture levels. So knowing all those things can help guide a practitioner to exactly what kind of product is going to work for you to help improve those things on your skin that we don't like, as well as prevent things from happening.
Okay, so what if you go through that whole process and you realize that you have dry skin? Maybe it's a little bit flaky. What do you do about that?
So dry skin, it's a combination of things. So of course we need to moisturize. Dry skin doesn't have enough moisture. The other thing that people often forget is that you actually have to exfoliate. So you have to turn over those dry skin cells to get them off so that the moisture can penetrate in the layers that we need the moisture in. And you have to be careful, because if you look at exfoliation out there, there's a whole range of, how coarse the exfoliation is. And you want to make sure that you don't use anything that's going to irritate your skin. You just want to be able to remove those cells so that the product you're using to moisturize can actually get it where you want it.
Oh, I love that. Okay. What if you have oily skin? Maybe you have a little bit of a shine. Maybe you get blemishes. What do you do about that?
Right. Oily skin. The big problem there is people think I need to use a strong product, and we end up stripping the skin of oil and really irritating it. So what the skin does to combat that is it makes more oil. So now you've made your oily problem worse, and you're even shinier than before, and you're using this strong product. So we usually still want to exfoliate, and we want to use things to minimize oil. But you still actually do want to have a moisturizer when you are an oily person, so that your skin is getting the moisture it needs and not feeling the need to produce a lot more oil. But people that have oily skin will need a lighter moisturizer that's non-pore clogging, as opposed to people who are dry that need a heavier moisturizer.
Good to know. Dr. Chandler, we only have a little bit less than a minute left, but I want to get to the last 2 on your list. If you have combination skin, or if you have damaged skin, what do you need to do? We'll start with combination and then go to damage real quick.
So combination, of course, you still need to moisturize. You still need to do SPF, but you need to choose a moisturizer that is made for combination skin. So one that is not for like an oily skin person, but not necessarily for a dry person. And sometimes we'll even use 2 different products to treat those areas. We usually are oily in our T-zone and dry in our cheeks. And so we'll use different products for those.
All right. And just to wrap it up, we only have about 10 seconds left, but if you do have damaged skin, I imagine you need to get some help.
Correct. So I definitely encourage people to come see a skincare specialist and have an analysis. because usually damaged skin is something that needs someone who specializes in that. So as far as just treatments like chemical peels or things to inhibit melanin from forming or the pigment in your skin, and then always an SPF of at least 35 every day, even on a cloudy day.
All right, very good. We're putting all of your information on the screen. Dr. Chandler, thank you for spending some time with us this afternoon and sharing your wisdom. We do appreciate it.